Every man over 50 has noticed changes. Changes in energy, changes in body composition, changes in sexual function, urinary function, recovery from exercise. And most men either get no explanation at all, or they get a dismissive, "That's just aging," from a busy doctor who moves on to the next patient. Today I'm going to give you the complete, honest, specific explanation, and more importantly, tell you what you can actually do about each one. I am Dr. James Whitaker, board-certified urologist, and I want to start today by saying something that I believe deeply. Aging is not the same as decline. Biological aging is inevitable. The passage of time produces changes in every system of the body that cannot be entirely stopped. But the rate at which those changes occur, and the degree to which they affect your quality of life, is profoundly influenced by what you do. The men who understand what is happening in their bodies as they age, and who take deliberate steps to address those changes, age very differently from the men who simply accept progressive decline as inevitable. Today I want to walk you through the major biological changes that occur in the male body from the 50s onward: the hormonal shifts, the vascular changes, the urological changes, the musculoskeletal changes, and the sexual function changes. I want to give you the medical explanation for each one, and I want to tell you what the evidence says you can do about it. Let's start with the most foundational change: testosterone decline. Beginning around age 30 to 35, testosterone levels in men begin declining at approximately 1 to 2% per year. This is not a sudden drop. It is a gradual, continuous decrease. By age 50, many men have testosterone levels 30 to 40% lower than they did at their peak. By age 70, some men have levels that qualify as clinically deficient. The consequences of this decline are systemic. Testosterone regulates muscle mass. Lower testosterone means progressively less efficient muscle protein synthesis, which is why men over 50 find it harder to maintain the same muscle tone they had at 40, even with the same exercise. It regulates bone density. Lower testosterone increases osteoporosis risk in men, a fact that is severely underappreciated. It regulates fat distribution. Lower testosterone promotes accumulation of visceral abdominal fat. It regulates mood, motivation, and cognitive function through its effects on brain chemistry, and it directly affects sexual function, which I will address separately. What can you do? Resistance exercise is the most powerful natural stimulus for testosterone support. Sleep is the most important recovery window. Limiting alcohol is important. Alcohol suppresses testosterone production directly, and for men whose levels have declined significantly and whose symptoms are meaningful, testosterone replacement therapy under proper medical supervision is a legitimate, well-studied, effective option. The second major change is vascular. Your blood vessels, the arterial system that delivers blood to every organ in your body, including your penis, undergo progressive changes with age. The endothelium, the delicate single-cell layer lining of your blood vessels, becomes less efficient at producing nitric oxide. These changes are driven by a combination of aging itself, compounded by the effects of blood pressure, blood sugar, inflammation, and oxidative stress over decades. The vascular consequences for sexual function are significant. The penile arteries are among the smallest arteries in the body. They show the effects of vascular aging and vascular disease first. This is why erectile dysfunction is considered a marker for cardiovascular disease. A man with ED has a significantly higher probability of having coronary artery disease than an age-matched man without ED. The penile arteries are essentially a preview of what is happening throughout the vascular system. What can you do? Aerobic exercise is the single most powerful intervention for vascular health. It stimulates nitric oxide production, reduces arterial stiffness, improves endothelial function, lowers blood pressure and inflammation. Dietary choices matter significantly. Mediterranean-style eating with abundant olive oil, fish, vegetables, and limited processed foods has the strongest evidence for cardiovascular and vascular protection. Blood pressure control is critical. Uncontrolled hypertension damages the endothelium systematically, and the same lifestyle interventions that protect your heart are protecting your erectile function simultaneously. Before I continue, I want to pause and ask you to subscribe to this channel. I'm Dr. James Whitaker, and every week I share exactly this kind of detailed, honest medical information. Hit subscribe, hit like, and drop a comment below. What change in your body have you noticed most as you've gotten older? I genuinely want to know. The third change is urological. The prostate, as I've explained in detail in previous videos, continues to grow throughout life. The combination of an enlarging prostate and an aging bladder muscle produces the urinary symptoms that affect the majority of men over 60. Reduced urine flow, increased frequency, nocturia, urgency, and incomplete emptying. These symptoms are collectively referred to as lower urinary tract symptoms, or LUTs. Simultaneously, The bladder muscle itself changes with age. The sphincter mechanism also weakens slightly with age, contributing to the occasional leakage that many men over 60 experience, but almost none admit. What can you do? Maintain a healthy body weight. Excess weight increases abdominal pressure on the bladder. Practice bladder retraining to expand functional capacity. Reduce evening fluid intake and eliminate caffeine and alcohol in the evening. Exercise the pelvic floor, which I covered in a dedicated video, and work with a urologist to evaluate prostate health and determine whether medication would help manage symptoms that are affecting quality of life. The fourth change is in body composition and metabolic function. Sarcopenia, the age-related loss of muscle mass, begins in earnest after age 50 and accelerates progressively. Without intervention, men lose 3 to 5% of muscle mass per decade after 50, and the rate increases after 70. Simultaneously, metabolic rate slows as muscle mass declines. Muscle is metabolically active tissue, and less of it means fewer calories burned at rest. The combination produces the body composition shift that most men notice: less muscle, more fat, even with no change in eating habits. The mitochondria, the energy-producing organelles in your cells, become less numerous and less efficient with age, contributing to the fatigue and reduced exercise capacity that many men experience. Insulin sensitivity declines, making blood sugar regulation less efficient and increasing risk of type 2 diabetes. What can you do? Resistance exercise is the most powerful intervention for sarcopenia. Studies demonstrate that even men in their 70s and 80s who begin resistance training build measurable muscle. It is never too late. Adequate protein intake, distributed across meals rather than concentrated in one, supports muscle protein synthesis. Consistency in both exercise and nutrition is more important than intensity. The fifth change is in sleep architecture. Slow-wave sleep, the deepest, most restorative stage, decreases substantially with age. REM sleep also becomes less abundant. The practical result is that even men who spend adequate time in bed often do not feel fully rested, because the quality of their sleep has changed, even if the quantity has not. This affects testosterone production, cognitive function, immune function, and emotional regulation. What can you do? Morning sunlight exposure to anchor the circadian rhythm, as I discussed in the morning routine video. Evening darkness, limiting bright artificial light and screen use after 8 or 9 p.m. allows melatonin to rise appropriately. A consistent sleep schedule, cool sleeping environment, lower body temperature facilitates deeper sleep. None of these changes are destiny. Each one is influenced by the choices you make every day. Men who exercise consistently, eat thoughtfully, sleep adequately, and manage their health proactively age differently, measurably, meaningfully differently than men who do not. I am Dr. James Whitaker. Subscribe to this channel. Share this video with a man in your life who needs to hear this. I'll see you in the next video.